So we had seen about iron deficiency anemia. Let's move on to the next type of anemia, which is anemia of chronic disease. So anemia of chronic disease is cause of both normocytic normochromic and microcytic hypochromic anemia. So as the name suggests, there is going to be some chronic disease because of which there is going to be anemia. So what is the pathogenesis here? Whenever there is a chronic disease, there is going to be chronic inflammation, and with chronic inflammation, there is going to be lots of interleukins and cytokines which are being produced. So interleukin 1, 6, TNF alpha, these are going to be elaborated, out of which this interleukin 6 is the most important one, because this interleukin 6 is going to cause decrease in the erythropoietin secretion. So when erythropoietin secretion is going to be decreased, there is going to be a normocytic normochromic anemia. So erythropoietin is the stimulus for erythropoiesis, right? So without that, there is going to be normocytic normochromic anemia. Apart from that, whenever there is chronic inflammation, the bone marrow is trying to produce more and more of WBCs. So it is channelizing its energy to produce WBCs for counteracting whatever stimulus is there. So WBCs will be produced, and when WBCs are produced more in number, so the erythropoiesis is going to get diminished. Okay, so that is another reason. And then with this interleukins, which are interleukin 6 again, so it is going to cause a increase in the serum, increase in the ferritin, increase in hepcidin, and a decrease in the transferrin. So whenever there is any inflammation, there is going to be acute phase reactants which are produced by the liver, right? So in that I already mentioned there is going to be positive acute phase reactants and negative acute phase reactants. So this ferritin and hepcidin are positive acute phase reactants, and transferrin is a negative acute phase reactant. So acute phase reactants are produced in response to inflammation. So transferrin levels are going to go down, and ferritin levels and the hepcidin levels are going to go up in this inflammatory condition. So whenever hepcidin is going to go up, what will happen? I told it is going to try to keep the iron in the storage form, right? So it is going to degrade the serum ferropotins, the ferroportin present on the basolateral membrane of duodenal cell. So ferroportin is going to be blocked and degraded, and so the iron is going to be kept in the storage form itself. Okay, so this again is going to cause a decrease in the iron absorption. So hepcidin is going to diminish the iron absorption as well. So as a result of this, there is going to be, with hepcidin increase, there is going to be decrease in the serum iron. So serum iron is here diminished at the end stage in anemia of chronic disease. So when iron is diminished, here again it can lead to microcytic hypochromic anemia. So usually it is the normocytic normochromic anemia which is common in anemia of chronic disease, while in later stages it can become microcytic hypochromic anemia when serum iron levels go down. So what will be the findings which we see in anemia of chronic disease? So peripheral findings, it will be normocytic normochromic anemia more than microcytic hypochromic anemia, right? Serum iron levels, I told it is going to go down. And then serum ferritin levels, how will be the serum ferritin levels? It was a positive acute phase reactant, right? So it is going to go up, and also ferritin is going to be kept in, the hepcidin is going to increase. It is going to keep the iron in the storage form. The storage form is the ferritin. So ferritin is going to be increased, while the serum transferrin saturation, it is going to be going down. So down or lower, normal, okay. And the total iron binding capacity will also be decreased here, okay. And if you see the ratio, the serum transferrin receptor to log of serum ferritin ratio, it is going to be less than 1.5, while in IDA it was more than 1.5. So how do you treat these patients? You will have to treat the chronic disease to help these patients.